Welsh and I'm the Chief Executive Officer of Maryborough District Health Service, and I've been asked today just to really talk to you about what the journey is like to become a CEO of a rural health service. My background is I'm a registered nurse and still a registered nurse, but it's been an interesting journey, I guess, to get to this point. I grew up in Echuca, which is of course now turned into a fairly large regional centre, but when I grew up there it was a smallish, close-knit community, and I did all of my schooling through there. To say I wasn't a golden student would be an understatement, but that really hasn't stopped anything along the way. And from there I was able to do Year 12 and then progressed to, of course, tertiary education for my nursing. Passed my nursing course with some interesting times, and again, I wasn't a golden student, and it was really interesting because at that time I went to university and I certainly had a lot of fun along the way. And when I completed university, my marks were nowhere near good enough and I could not get a graduate nursing position. So in effect I was unemployable, and it took some persistence and some nagging, and I eventually got into a casual pool and was able to then prove myself to be a good clinician. My wife and I then moved to Canberra, where again I worked in a big primary care unit and a big emergency department, and I just continued to study and learn and enjoy the clinical aspects of the role, the connection with people, the working within the team, and everything that comes from being a nurse. And that's been really the backbone of everything that I'm about still today. I love the impact of what we have at the bedside. My goal was never to be a CEO. I just enjoyed being a clinician, and I moved to Goulburn Valley, and I worked with probably the most inspirational person I've ever worked with there, called a lady by the name of Geraldine Webster. And she took me under her wing to some degree and gave me a chance to be a unit manager. They must have been short of options, I think, but the reality is she gave me that opportunity, and that was the best thing that ever happened. I did a 6-month stint first of all, and I failed badly at the job. Did a very poor job. I was a pig-headed, bullish 24-year-old who thought I knew the world. I didn't listen to the team, I didn't integrate with the team. You can imagine the story. But Geraldine didn't drop me off the radar. She took me under her wing, very much supported me back into that role, eventually permanently. And from there, it really allowed my career to flourish. It taught me the importance of team. It taught me the importance of having fun at work. It taught me the importance of culture and working with your team to have a really strong focus around good clinical care and good staff environment. Living in a small town, very interesting, because you go down the street and here's the staff member or the husband of the staff member or patients. You were never off duty, and that was something that first really challenged me. And over time I just became very comfortable, because if you're doing a good job and you're honest with your community and you connect with the community, it doesn't matter where you live, because people know no hospital is infallible, but they understand that you're committed to the community and you're committed to the service, and that's all that matters.
Hi, I'm Lisa. Lisa Evans. I started nursing when I was 17 at the Maryborough Hospital in the acute wards and aged care. I practiced over there for probably about 5 or 6 years, and then probably had a time when I thought, maybe have I chosen the right profession? I certainly enjoyed it, but I just wondered what more was to be offered. So I then discovered that there was actually more to nursing than just perhaps working in hospitals, that it was quite a diverse occupation. So I had a look into working in primary care. Primary care probably saved my nursing career, I think, because I think the values of preventative care for patients when they're well, and looking out for them in the sense that, you know, what could go wrong, what can we do to prevent that, is a lovely type of nursing. I think, you know, because we do essentially see them when they're quite well, we just have to help manage their conditions and their lives and so forth. So I find that really rewarding. Primary care has its big advantages as well with hours. Like a lot of nursing shift work was probably the reason why I liked to venture out somewhere else. primary care is Monday to Friday. So when you look at, it's okay when you're a young girl, but as you get older and start a family, then it really does suit the family home life as well, so with raising children and so forth. With primary care, you're the first point of contact for healthcare. So when you've got the hospital setting, unfortunately people will go in as a second point, they're unwell and they need assistance with medical care. Primary care is your first point of contact with your GP and your nurses. So it might be just basically to fill your scripts or come in because I've got a sore on my leg or something like that, or for immunisations and so forth. So injections, whatever. So it's the first point of contact with healthcare, and it gives the health professionals the opportunity then to recognise the patient's chronic diseases, if they have any other problems like high blood pressure and how we can manage that, and then pick up risk factors like smoking and alcohol consumption that would be not helping them with their health. Empowering in the holistic sense that it's not just physical, it's mental as well, and I think that they both need to be maintained to be able to keep your wellness. So that's really important. So